So as our Instagram following grows, we're getting a lot more inquiries through Instagram, and we're getting a lot of follow-up questions from existing patients or people who want information about a specific procedure. And we're not really keen on answering those. And I wanted to tape this little video to kind of explain why we're not really big on answering medical questions on Instagram so that you guys don't feel like we're just kind of blowing you off. So while our Instagram makes it feel like it's a lot of fun at our office and you're going to come, you're going to have some laughs, you're going to get some good surgery, and then you're going to go home feeling great about yourself, it is important to remember that this is a medical office. I am a surgeon and a medical doctor, and surgery is very serious. So despite the fact that we have a lot of fun on Instagram and I let you guys enjoy the process, it's important to remember that in my mind, I'm constantly thinking of the 12,000 things that I want to make sure don't happen during your surgery so that you can just focus on your good outcomes. But as part of that, we have to keep a proper medical record according to all sorts of laws and rules, and it's basically impossible for us to take Instagram conversations and put those into the proper medical record. So we can't document things properly if you're asking us follow-up questions on Instagram, and that's why we're not really keen to answer them. So if you've had surgery and you have a question about something going on in recovery, whether it's just, hey, wondering when I can get back to exercise, or if it's something as significant as, oh my God, this thing's bleeding, is this a problem? We would generally ask that you contact the office, or in the case of this thing's bleeding, is this a problem? You can call my cell phone. If you're a patient, you'll already have that in your information packages. That way we can at least document things properly, put it into your chart, and make sure that everything is totally above board. The other reason that we don't like to answer too much in terms of specifics on Instagram is because things become outdated very quickly. People love to ask for pricing, and while we would generally be happy to give that in the comments section of a post, those posts are still hanging around 2 years later, and pricing that may have been accurate today might not be accurate 2 years from now. It may be talking about a procedure that I don't even do anymore. So we don't want to have that still hanging out there for people to get the wrong impression. We are happy to answer general questions about pricing over DMs, but if you want a specific price for your case, we really need to have a consult so that I can see exactly what needs to be done, and then we can give you a price that is specific to your case. So in general, we don't like to answer personal stuff over Instagram, but it's nothing personal towards you. It's just us making sure that one more aspect of our practice is to the highest standards possible, above and beyond what the laws require.